Welcome to today's discussion on whole versus reduced fat milk and childhood obesity. Childhood obesity has become a major public health concern, with rates tripling over the past 4 decades. In North America, nearly 1 in 3 children is now classified as overweight or obese. As a result, health authorities have recommended dietary changes to help reduce this risk. One of the most widely accepted recommendations is to switch from whole-fat cow's milk to reduced-fat milk for children over the age of 2. This guideline has been adopted by many healthcare providers, schools, and families. However, evidence about the relationship between cow's milk fat and childhood obesity has been inconsistent. Reduced fat milk is often thought to help prevent excessive weight gain, but recent studies are starting to challenge this assumption. Some research even suggests that children who drink whole milk may have lower rates of overweight and obesity compared to those who consume reduced fat milk. Considering the large role cow's milk plays in children's diets by providing energy, protein, and fat, understanding the effect of milk fat on childhood obesity is critical. This systematic review and meta-analysis was conducted to synthesize the available evidence on the relationship between cow milk fat intake and childhood adiposity. The goal is to help shape future dietary guidelines. The background here is that childhood obesity has become increasingly common, and over the years, there has been a shift from whole-fat cow's milk to reduced fat milk. This change has been driven by organizations like the American Academy of Pediatrics, which recommends reducing fat intake in children to prevent obesity. The objective of the study was to assess how cow milk fat consumption affects adiposity, or body fatness, in children aged 1 to 18 years. To do this, researchers conducted a systematic review of observational studies from multiple databases up to August 2019. A total of 28 studies were included. 20 of them were cross-sectional and 8 were cohort studies. However, no clinical trials were found. The meta-analysis revealed that children who drank whole milk had lower odds of being overweight or obese compared to those who drank reduced fat milk. In fact, the odds ratio for overweight or obesity was 0.61, favoring whole milk consumption. While most of the studies, 18 out of 28, showed a link between higher cow milk fat intake and lower childhood adiposity, 10 studies found no significant association between milk fat and obesity. In conclusion, observational data suggests that drinking whole milk may be linked to a lower risk of childhood, overweight, and obesity compared to drinking reduced fat milk. These findings challenge the current dietary guidelines recommending reduced fat milk for children. The study calls for randomized trials to help better understand which type of milk might minimize the risk of excessive body fat in children. Although this review offers strong observational evidence, further research through randomized trials is needed to confirm these findings. Thank you for watching, and we hope this research provides valuable insights into the relationship between milk fat consumption and childhood obesity. For more information and studies, be sure to check out our healthcare resource hub to learn more.